All right, good afternoon, everyone. My name is Nathan Carter. I'm the Community Relations Manager for Johnson County Mental Health Center. But today I'm hosting on behalf of Metro Council. Metro Council, the Metropolitan Council of Community Mental Health Centers, is a collaborative membership organization representing the public mental health system of community behavioral health centers serving the greater Kansas City area. We provide support to our member organizations and education, information, and resources to the public on accessing quality behavioral health services. We host these free webinars on the second and fourth Thursday of every month. And we also host the annual Mental Health KC conference in May. In fact, the 2025 Mental Health KC conference is next week, May 29th and 30th at Johnson County Community College in Overland Park. Registration is still open. I will drop the link in the chat. It's only $75 to attend the whole conference, which includes lunch, snacks, and a certificate of attendance, and of course, some cool Mental Health KC swag. New for this year, for an extra $20, we have pre-approved CEUs available for those that want or need those CEUs. So take a look at that registration link and consider joining us, and we look forward to seeing you there. Before I introduce our presenters today, I just wanted to let you all know we will have time for questions at the end of their presentation. At the bottom of your screen, there's a chat button and a Q&A button. As the presentation goes along, if you think of a question, go ahead and drop it in there, and we'll get to as many of them as we can at the end of the presentation. You're also welcome to save the questions for the end as well, but sometimes it's nice to get those questions out while you're thinking about them. Also, our standard disclaimer, the views and opinions presented in today's presentation are those of our speakers and do not necessarily represent the opinions of Metro Council. So I'm excited to introduce our presenters today, three of my colleagues. They lead the Secure and Protect Initiative, a suicide prevention effort that is reaching out to gun owners in Johnson County. My team, the communications team at Johnson County Mental Health Center, has had a chance to work with them on some content and materials for this project. We've learned a lot from their work and had a lot of back and forth and dialogue on the language and presentation around this initiative. It has been interesting, challenging, and ultimately rewarding as everything comes together. So I think you'll have a similar experience and really enjoy their presentation today. Mallory Gevertz and Jared Avilez are community prevention coordinators with Johnson County Mental Health Center, and Patrick Bainbridge is the community engagement and partnership coordinator for the Kansas City VA Medical Center. Their presentation today is Approaching Suicide Prevention with Gun Owners, the Secure and Protect Initiative. And with that, I will turn it over to you three.
Thanks, Nathan. Okay, can everyone, you won't be able to tell. I'm assuming you can all see the slide. So like Nathan said, this is the Secure and Protect Initiative. And like he said, there was a lot of bumps and things along the way, but it's been really cool to see this initiative grow. And I think we really take a unique approach when we are doing our initiatives, specifically working with the gun retailers, and we'll talk more about that throughout this presentation. My name is Mallory Gevertz. I'm a community prevention coordinator with Johnson County Mental Health Center. I also chair the Johnson County Suicide Prevention Coalition. In my role as a community prevention coordinator, I'm really out there educating and spreading awareness to the community about mental health, suicide prevention, substance use prevention, all things prevention.
I'm Jared Avilez. I work alongside Mallory at Johnson County Mental Health Center and alongside Nathan. Don't want to forget Nathan. I am a community prevention coordinator as well, and I am one of the team members of the Secure and Protect Initiative. I also am a trainer for mental health first aid classes in the community and I am a MANT crisis de-escalation trainer internally for our mental health center. And on a personal note, I've got a couple kiddos. Hudson's 5, Hadley's almost 2, so I'm a dad. I'm a big outdoor recreation fan, and so this project that we work on together, I'm very passionate about, and I hope today you have a few takeaways from us, and we do a little bit of learning together. So thank you for having us.
Yeah, my name is Patrick Bainbridge, Community Engagement and Partnership Coordinator with the Kansas City VA Medical Center. I work within the suicide prevention team, but I am on the public facing side of it. So my role, and I'll talk a little bit about it because it's the primary reason I got involved with Mallory and Jared here. But my role is about pushing out the VA's public health approach to veteran suicide prevention, and this initiative falls right within that. So I'll talk a little bit about that more as we get going. But yeah, that's who I am, and I'm glad to be able to be a part of this training, and I think share something new with people about what a what a different approach to suicide prevention, and especially as it relates to firearms and suicide prevention as well. So hope you all can take a lot from this today.
All right. So the Secure and Protect initiative works to build partnerships within our community to encourage responsible firearm ownership, reduce stigma, and protect lives. And like I said, we really take a different approach, and we are starting with the firearm retailers. So our initiative really came about in the summer of 2023, so about 2 years ago now, from a coworker of ours named Alex. He is now a co-responder. And he had this idea for a practicum project to host a suicide prevention mental health training for firearm retailers. And so we formed this group. It was the three of us, Alex, we had Bob with American Foundation for Suicide Prevention. We had Andy Tilton with Adam's Story. And then along the way, we also coordinated with Mike Sodini with Walk the Talk America and other folks from Walk the Talk America, which they were amazing in helping us throughout this project. So we really tried to decide, like, how do we want to reach out and how do we want to initiate these conversations about even hosting this training? So we landed on a boots on the ground approach, and we decided we were just going to walk into these firearm retailers. And so what we did was we had someone from the mental health center, a team, they formulated a list of all of the Johnson County FFLs, and that stands for Federal Firearm License. So in Johnson County, there's over 150 FFLs, which is a really long list. But when we broke it down, it really only came down to about 26 box stores that we could walk into and introduce ourselves. And that list ended up even getting smaller along the way, just because it was a lot harder to get into like academies and Walmarts. So we're really focusing on those like mom and pop shops in Johnson County. So we got that list together, and then in August 2023, we did our first outreach, and that was quite the process. We first walked in saying, "Hi, my name's Mallory Geverts, and I work for Johnson County Mental Health Center." And immediately they kind of put up their walls. And so we really worked with Mike with Walk the Talk America. Walk the Talk America is a national organization that really works on reducing stigma and firearm-related deaths as it relates to suicide. So they really helped us formulate our approach, which was, we're not here promoting any type of policies. We're just here to talk about suicide prevention. So we did that initial outreach in August. And between August and April, we did a couple of outreaches to the stores, and we hosted a QPR training, question, persuade, refer, for the retailers. We had one store show up, Eagle Armory, and they're out of Overland Park, and they were able to share some really helpful things for us, like what warning signs and symptoms they might see in their store. And from that information, we kind of determined that QPR wasn't the best training for them. But they took a lot of our materials, like our 988 suicide crisis line posters, and you'll see some pictures of those later on in the slide. So between April and October, we received the Kansas Community Suicide Prevention Grant to help us kind of fund our project, and that's through KDADS. In October, we hosted our Walk the Talk America training, which was about guns and mental health. And that was for clinicians to really understand gun culture and the stigma and really why gun owners kind of don't want to reach out for help always. And then many months later, March, we launched our gun safe distribution program, which Jared will talk about a little bit later. And then in April, which was about a month ago, we are proud to say that we launched our TAP program, which is the Armory Project, which Jared will also touch on later. So that is where we are at as of today. So why is this important? Firearms are the most used method of suicide in Johnson County and in Kansas. And Kansas is way above the national average. And so 59% of all suicide deaths in Kansas are by firearm, and 50% of suicide deaths in Johnson County. So that percentage goes up even higher with veterans, which I'm sure Patrick will touch on a little bit later. But 77% of veterans who die by suicide in Kansas use a firearm. So those are some pretty significant numbers. And when you think about 50% of Johnson County residents own firearms, and that's just what's reported. So we can only assume that that number is significantly higher. And with that, I'm going to pass it over to Patrick.
All right, thanks, Mallory. Yeah, so like I said, again, my name is Patrick Bainbridge, and a community engagement partnership coordinator with the Kansas City VA within the suicide prevention program. Um, and like I had mentioned, I'm responsible for pushing out the VA's public health approach to veteran suicide prevention. And the important piece of making this a public health approach to suicide prevention is that um, to impact the people that we're wanting to, get interventions to hear messaging about suicide prevention. As it relates to the firearm community or the veteran community, we have to get messaging, we have to get interventions to where they're going to see it, to where they're going to experience the impact of it. And an important piece of that is finding messengers. There we go, and people that can help us get those interventions and those strategies across and really communicate to the population that we're trying to impact. The VA has learned a lot about suicide prevention over the years as it relates to veterans, and it's learned a lot about the public health approach to veteran suicide. And part of the reason that the VA has had to lean into a public health approach just to suicide prevention is for the simple fact that most veterans do not use the VA. And so, if we were going to impact that community, which is a high firearm ownership community, and that's why it was great for me and for Mallory and Jared, for all of us to get connected, because there's so much overlap between the population of gun owners and veterans. But how are we going to impact them and get them the resources and information in community level grassroots strategies that are actually going to get the suicide data going the way we want it to? Well, it requires community engagement. It requires getting out there and working with the community where they work, live, and thrive. And so it made sense for us to try to really get into the firearm owning community and talk to the stakeholders within that community. And so gun owners and gun shops, that is them. So how do we bring them into the fold, and how do we approach them? And really, that's the the goal behind public health strategy to suicide prevention is getting the community more involved and explaining to them and empowering them to be involved. The slide here shows the VA's public health strategy to suicide prevention, the community-based piece, clinical-based piece, which the VA is doing with our clinical care, but we don't impact all veterans. And in the community providers, they're not impacting all gun owners because they're, like Mallory had said, there's stigma between mental health and the firearm community. And so, how do we connect with that community we're trying to impact? Well, it's the community based approach. We had to get out there in the community, learn their language, learn what interventions were going to actually work for them, meet them where they are. In the clinical world, we talk a lot about meeting clients where they are. And if you're going to connect with the firearm owning community and the gun community, that is very much the case. There's lots of myths out there. There's lots of misperceptions. There's lots of mistrust. And so we really, with this approach and this initiative, had to meet them where they were and listen to them and what they were seeing and what they were experiencing. And that's a big part of community based suicide prevention. Um, Three tenets there at the bottom of this page. Suicide is preventable. We all know that if we can get individuals connected to care and connected to resources, it significantly reduces their risk. So, utilizing those community partnerships to get individuals, in this case, the firearm owning community, connected to care is important. It requires a public health approach. The Johnson County Mental Health Center can only impact who they're seeing. The VA can only impact who they're seeing. How can we create a greater impact within the community? Well, it's partnering with those in the community that already have the attention of the population we're trying to connect with. And that third piece, I think this is a big part of what we've done with this initiative is explaining to people and empowering people that may not otherwise believe they had a role in suicide prevention that they do have a part to play. You don't have to have a bunch of letters behind your name. You don't have to have a clinical background to have an impact on somebody or have an impact with suicide prevention. So we've with this strategy, we have done a lot of education and a lot of empowering of individuals to say, you know what, you do have an important role to play. Whether it's, Jared will go through a lot of the things that we're doing with the initiative, but this again, this initiative falls right into public health strategies, community-based suicide prevention, and you can go ahead and go to the next slide, Mallory. Um, and because again, going back to that, everyone has a role to play. This is a way you're going to see a lot of veteran in here, but you can interchange veteran and gun owner because there is so much overlap between those populations. When we say suicide prevention is everyone's business, it's just that those that are in crisis, gun owners that are in crisis, or veterans that are in crisis, the clinical side of it is may not be the first people that are able to intervene, the first people that are able to offer resources, the first people that are able to offer some type of an intervention. And so we are trying to reach those veterans and those gun owners and their families, where they're more likely to be. And so within the gun community, it has been for us the gun shops and getting them more involved and educating them about their role, building community engagement, getting out there, the VA, Johnson County Mental Health Center, clinical services, getting them more into the conversation of the firearm owning community to kind of break down some mistrust and break down some barriers. You know, One of the things that we found that's been very helpful, and it's this is the long game, is being present, continually popping in, continually to make those relationships, building that trust, being consistent, following through. That's really helped us with some of these relationships. And, we just recently did a round of outreaches and, you know, I work for the VA, so they always look at me like I'm the ATF. But Mallory and Jared, they're greeted with smiles and hey, how you doing? And then that is a difference maker. When you can build that community engagement, when you can build that trust, and they're far more likely to take our interventions and take our strategies and take what we've learned from them and implement that. Also the changing the conversation around suicide, being able to provide this community more education about their important role in suicide prevention, and that we need to talk about it and be more direct in getting individuals connected to resources and connected to care. And that's something I feel like we've been successful in the engagements that we've had. Developing the innovative prevention strategies, again, listening to the community that we're trying to impact, whether it's the veteran community, the firearm owning community. A lot of our strategies are based on those initial visits and the feedback that we learned from the gun shops and the gun owners, and walk the talk America, because we can create strategies all day long, but if they do not fit the community that we're trying to impact, everybody on here knows this, they're going to fail every time. So the strategy has to fit the population and the culture we're trying to work with. So the veteran community, the firearm owning community. So being able to develop those innovative strategies that we know are evidence based, but fit who we're trying to impact. And then, that continued increased impact of Office for Suicide Prevention. This is just whether it's Johnson County Mental Health, whether it's the Kansas Suicide Prevention Initiative, whatever, whoever is developing these strategies, just taking the evidence-based treatments and strategies that we know and getting them more out into the community, to the community that we're trying to impact. So all of this is to say, suicide prevention is everyone's business, and we're spreading that message and bringing a community into the fold that maybe not otherwise would think they would have a role to play. So next slide. So the things that we are trying to get them to implement, and the strategies that we're trying to have fit that culture and that community, this is the CDC's suicide prevention resource for action. These are their 7 pillars, and everything we're doing kind of falls within these a little bit. The VA has their own set of priority areas. You can go to the next slide, Mallory. And they're very similar, save for the identifying service members, veterans, and their families, because and this is very much for the gun community. If you can identify somebody as part of a particular community, whether it's the firearm owning community or the veteran community, you're able to really tailor your interventions and resources to that community, and that makes them more effective. So, identifying veterans, increasing suicide risk screening, promoting connectedness, transitions of care, increasing lethal means safety. I'll talk about some veteran data here in a second. Next slide, Mallory. So these were where all the CDC and the VA's priority areas align. These all fall in. Oh, they fall in together. And so when you look at these and what our initiative is doing, well, one, we are identifying and supporting people at risk, providing some education to the shops on what to look out for and what to be aware of, and how to refer those individuals and how to get them resources. Not I don't not to steal anybody's thunder or Jared's thunder maybe, but when we've done these outreaches, one of the things that surprised me is the gun shops and the gun community, they are seeing mental health crisis. They are seeing people struggling with mental health concerns. They are turning people away that they're not comfortable selling firearms to, or that they're comfortable having access to firearms. So, but they're doing it on their own. They're doing it in just their own kind of way. And, not to say that that's ineffective, but we're just trying to capitalize and maximize what they're already doing, so providing them a little more education and a little more and more tools, to refer people and where to get people connected to care. So they're already doing that, and we're just trying to support them in doing that. Improving access and delivery of suicide care, improving access, equipping them with some resources and some benefits, or resource guides and things that they can actually hand people and connect people with. So getting connected to resources through a gun shop, crazy idea, but it can happen, and it has happened. Promoting connectedness, improving transitions of care, promoting healthy connections. These gun shops function like barber shops sometimes. People come in and congregate, they hang out, they all know each other. It's an opportunity to even build more connection within the community if we're encouraging more open conversations about suicide and struggling with mental health concerns, or just struggling with daily life. Promoting those connections within that community, because we all know disconnect, isolation, loneliness, those are significant risk factors just across the board, even outside of veterans. And so if we can utilize, these partnerships and relationships with the gun community, we can help them build even more connection and help people feel more connected to their communities. Obviously, creating protective environments, lessening harms, that's lethal means safety. I'll talk about that here in a second in a little more detail. Um, but yeah, these are some of the priority areas that I work with as far as my role in the VA. And, they line up really well with the CDC. And I think a lot of these we are utilizing within the Secure and Protect initiative. You can go to the next slide. And so, kind of pivoting to, the main goal that we're focused on here with the Secure and Protect initiative, and that's lethal means safety. And so hopefully everybody on here is familiar with what lethal means safety is, and the importance of it, but I'll go ahead and just review that here over a couple slides. Because within the VA, we talk about lethal means safety all the time, and specifically as it does relate to firearms, because, that very first data point or slide that Mallory showed, for Kansas, 77% of the time veterans are using a firearm. Well, that's a little bit above the national average for veterans, but only by like 2 percentage points. So within the veteran community, we do talk about firearms a lot because it's just the primary method that veterans utilize. Um, so when we talk about firearms within the veteran community or just firearms in general, as it relates to lethal means safety, we're talking about time and distance, creating time and distance between the moment someone has decided to take their life and the moment they're able to obtain the method to do so. The bigger that gap, the less likely someone is to follow through on those thoughts. And so, a big component of the Secure and Protect initiative is building time and distance into the home. Um, Not all veterans, not all firearm owners, shockingly, are willing to remove their firearms from the home. Um, so, what can we do within the home? We talked about, or I talked about it a little bit ago about the culture and the community we're trying to impact and meeting them where they are. And so, if you're talking to firearm owners, if you're talking to veterans, it is critical to really meet them where they are and understand what your idea of lethal means safety is. Like, get them out of the house, go, that may not be where they're at. They might not be there. But how can you create time and distance in the home then? Because even seconds matter, seconds and minutes matter. And I've seen that just in my own clinical work when I was doing more clinical facing work within the VA. Um, but time and distance matters, and so creating more time and distance, whether it's through gun locks, whether it's through out of home storage, that's what we're trying to encourage. But also, I say this a lot when I do tablings and talk about lethal means safety. Lethal means safety isn't just handing somebody a gun lock. It's about the why. Why are we creating time and distance? Providing that education. Because when we can provide the education and why we're asking what we're asking and why we're looking to, maybe store medications out of the home or, change the lock on the gun safe and with only someone else knowing what it is, you know, we're not talking about restriction. We're not talking about infringement of rights. We're talking about creating a safe and safer environment when we know somebody in the home is at risk, or there's people in the home that shouldn't have access, whether it's young children or older adults, or somebody that we know is struggling with mental illness. So, lethal means safety is about securing your firearms, about keeping the environment safe, but it is also about understanding the why behind lethal means safety. And the more that we can educate about the why, and again, that's a piece of what we do when we have these conversations with the gun shops, explaining the whys. And so the more people understand the whys, the more likely they are to want to collaborate, want to have that conversation, want to work with you and find a way, to what works best for them. But still understanding, the community you're trying to impact and the community that we're working with. Um, there's many times in my own work with the VA and with veterans where, I had my idea what lethal means safety was going to be for that particular veteran and what was appropriate, but it ended up being different than what they were willing to do. So collaborating and identifying, well, what steps are they willing to take? So next slide. And this slide highlights a couple different points, and it does reinforce the importance of lethal means safety and securing firearms, especially if they're in the home. Most suicidal crises are brief. The time from decision to action. And this highlights a study from survivors who survived suicide attempts, and it talked about, that time frame from the moment they decided to the moment that they followed through or attempted to follow through. And so it can be impulsive. It can be very short. So it tells us a couple things. One, the importance of securing firearms in the home, the importance of having a lethal means safety implemented in the home, because this can be an impulsive act. It can take just not a lot of time from having that thought to acting. But the other piece is highlights the importance of creating that time and distance, because the longer that time goes, the more we can delay, the less likely somebody is to follow through. And the little cones on the side, that just reinforces the importance of having these conversations about firearms, because as a suicide method, they have around a 90% mortality rate compared to other methods. So this is a particular method that, we just emphasize, because of just the danger. Next slide, Mallory. And again, why is lethal means safety important? This is just some data points for veteran specific for you all to understand. 73.5% of the time, veterans in 2022 used a firearm. Um, 1 in 4 female veterans are gun owners. Our female veterans, if you do have an encounter one, don't assume that they don't use firearms or like that they're not at risk of using a firearm. The data point's not up here, but they're just under 50% of the time female veterans use firearms, and that's significantly higher than their non-veteran counterparts. They're more proficient with firearms, or more likely to live in a home with them. They're just more comfortable around them, and so um, it's just important to acknowledge that fact. Um, Really, what this slide kind of just shows is that firearms are part of the veteran community. Um, this isn't a slide, but we live in the Midwest. We have large rural communities. We have high firearm ownership rates in our communities here in the Kansas City area, the suburbs, the rural parts, within the veteran community. And so it's just, I think this slide really is data points, but it really highlights just the culture that we're trying to impact and trying to engage, and the importance of being culturally competent when having conversations around lethal means safety and secure firearm storage. Um, Next slide. I like visuals, so here's a good visual for you of firearm usage within veteran population compared to non-veterans. Again, just highlights the difference and the risk involved within certain populations as it relates to firearm suicide. So this is something certainly just to be aware of. Next slide, Mallory. And this is my last slide, and I'll stop talking. But lethal means safety. So these are just some examples of for firearm storage. Jared will get into exactly what the Secure and Protect initiative been doing, but um, it's good to kind of figure out, how do you store your firearms in the home? It's we can do a whole other training on how to have lethal means safety conversations, and I'd love to be a part of that. But if you can get to the part where they're comfortable talking about firearm storage and firearms in the home, first understanding how do they store their firearms in the home? Are they all secured in the home? And then just understanding that these are some of the different ways that you can create lethal means safety in time and distance, ensuring there's a separation from the ammunition and the firearm itself, whether the ammunition's out of the home, whether they're stored separately, ensuring just a baseline level and just good practice as a gun owner. Lock your guns up, make sure they're secured in the home, make sure they're unloaded. Don't leave, within the veteran population, we very often, yeah, I lock up all my guns except the one. And that's a conversation to have, but really focusing on making sure all firearms in the home are secured. If they're not willing to have the firearm out of the home, they'll give the lock key to someone else. That can be a good way. If there's someone in the home that they can trust, give them the key to the lock, help change the combination to the safe and give it to someone else. But be creative, be collaborative. Probably the most important thing is to be collaborative. You all know this. If someone feels like it's their own idea, they're more likely to follow through with it. So exploring with them what they are willing to do to create lethal means safety in the home. um, well, I hope my little portion of this was beneficial. I'm happy to answer any additional questions about it. But a lot of this is just the background on why it's important to engage the community, and the reasons why, and what is effective as far as community engagement and community based suicide prevention. So kind of the foundation for the Secure and Protect initiative. And so I will hand it off to Jared, who's going to get into the weeds of what this looks like.
Thank you, Patrick. Much appreciated for all that information and the context around the overlap really between firearm owners and veterans. Our initiative has encountered numerous situations where we've seen our initiative, either help or at least encounter a veteran in crisis. So I will talk a little bit about how our approach, what it looks like, how we developed it, and then really how our approach is being applied in the community. And I'm going to highlight 2 specific examples as I walk through this with you all. But I kind of want to set the frame of this piece of the conversation to help you all step into the mind of a gun owner a little bit. That's what we had to do when we started with our boots on the ground approach, like Mallory talked about. We were walking into gun stores, not really understanding fully how to have the conversation about mental health in a way that resonates with the gun owner. And we've learned a lot as we've gone through this process. And as Nathan mentioned in the beginning, we workshopped our name. Like, how are we going to present ourselves to the community that resonates with the gun owning community? How can we get the message to them? And through a lot of workshop, through a lot of research, through a lot of anecdotal experiences, we came up with the name Secure and Protect. And I just want to spend like 2 minutes explaining why we chose that name. So to kind of set the stage for that, we talk a lot about responsible storage within the firearm conversations, okay? Safety is a big piece of firearm culture, but something that gets missed sometimes is that people think they're being safe when maybe they're not being safe. They think their firearm might be secure when maybe it's not as secure as they think it is. So an example being, somebody comes home from a gun range, they have their firearm, maybe it's still loaded, and they have it in a holster and they set it on the counter. And it's somewhat secure, right? You can't access the trigger to that firearm, but it's easily accessible to other people in the home. So is that being very responsible with our firearm? Not necessarily. And so we try to promote responsible securing your firearms in a responsible manner, because what that does is it allows for storage of your firearm, because that's going to look different for every firearm owner and every home. Storage is going to look a little different. Veterans are going to store their firearms in a way they feel comfortable, and another firearm owner is going to store in a way they feel comfortable. So we have to talk to people about responsible storage, much like the alcohol companies talk about drinking responsibly. If we're going to go out and drink, we're going to do it responsibly, okay? We're not going to drink and drive. Similarly, we're having the same conversations with gun shop owners and gun owners themselves. We own firearms, we want to own them, and we want to secure them responsibly within our home. Are there kids in the home? Are there not kids in the home? So responsible storage of firearms is a big piece of our approach and securing things responsibly. So that's kind of where that secure piece, that secure comes from. Secondly, protection. That was another word that resonated with the gun community and that we saw in our kind of like our marketing research, right? We'd go to gun shops, we'd look at advertisements, we'd talk to gun owners, and we do research on this. And research demonstrates, and you can find this pretty widely accessible research demonstrates that most firearm owners own for the region of self-defense and protection. That's why many firearm owners own a gun. Not every single one, but many of them. And 70% of gun owners do cite a fear of losing their firearms as a top reason why they don't want to seek mental health services. Okay, because if they open up about it, they're in fear that A, their firearm's going to be taken away, or B, they're going to be labeled a violent person, because we see a lot of mass shootings and things in the media that might make them feel as though people are going to judge them for owning a firearm. So there is some stigma around opening up as a firearm owner, but they still feel that it's really important to their personal safety to protect themselves and their family. And so we also want to encourage firearm owners. Yes, we want to respect that, but we also want to encourage them to protect their minds. And that's where the Secure and Protect initiative comes together, securing your firearm responsibly and protecting, yes, yourself, your family, and your mind. And we're going to try to meet you where you're at. And that's really the essence of our approach. And many of you that are in the public health or mental health world, meeting folks where they're at, that's what we want to do. Because like Patrick said, if we can help people in a way that they think it's their idea or feels comfortable to their culture, we're going to have a better success rate with the outcomes and the targets that we're aiming for. So I won't spend a ton of time on this because Mallory talked about it a little bit, but this is one of the ways that our SPI initiative or our Secure and Protect initiative is implementing different tactics in the community, and that's just relationship building in the gun shops. We have gone out quarterly for about the last 2 years now and developed relationships and have gotten gun shops either to come to suicide prevention trainings or put suicide prevention materials in their shops to promote that mental wellness education to gun owners, to start changing that conversation and culture a little bit. And so that is, like Patrick said, a consistent thing that we are constantly doing with the gun shop owners. And I don't want to spend a lot of time on that or this one as well. We're trying to provide more community trainings like today, or trainings like we did back in the fall with guns and mental health, to help people understand One, the stigmas around gun ownership and accessing mental health, and how we can start having a more improved conversations around that, and just really better understanding the culture as a whole, because it can be a hard topic to talk about. And so that's one way we're implementing our initiative in the community. But really, what I want to spend a little bit of time on is our gun safe distribution program. I'm very thankful that our team has been able to partner with the emergency services team with Johnson County Mental Health and the co-responders there, along with the crisis action teams and law enforcement officers in the community. If any of you aren't aware of the co-responder program, basically we have mental health clinicians in the community that can get dispatched to a mental health crisis call that's received by law enforcement, and they can get dispatched to that and go help do either safety planning or whatever the need is on that call. And so we're very fortunate here in Johnson County to have that. What we have done is we've done two things with our co-responder teams. We've distributed gun safes to all of them, and we've provided some light education and training on how to have conversations. And so I want to speak to the gun safes specifically. What we've done is we've taken what we've learned from our boots on the ground approach, and we provided the co-responders and law enforcement officers with an additional tool to have during those safety planning conversations. If they get called out for a suicidal ideation, they have another tool in their tool bag, and that tool is a quick access safe. Now, that might sound a little counterintuitive when we're talking about safety planning, because generally we're talking about separating the ammunition from the firearm and also locking the firearm up and keeping those things as separate as possible. And yes, that is like gold standard. That's really what we want. We want as much time and distance in between a person and their firearm as possible, as much time as distance as possible to reduce the risk of taking their life with that firearm. Again, however, many veterans, many gun owners feel that is very counterintuitive to the whole reason they own a firearm, for self-defense. If they feel the need to access their firearm quickly in the moment of self-defense, locking it up and separating ammunition makes absolutely no sense to them. It's kind of like having a car in your garage with no wheels on it. It's there, but it's not very usable. And so where do we meet them where they're at? How can we find some middle ground? And so the approach we've taken is to have the co-responders offer a quick access safe so they still have a level of access to their firearm, but also a level of barrier during those tough days, during those tough moments. With that quick access safe, they also have a cause a pause magnet that has been distributed with those. And it's a magnet that goes on the safe. And there is an outline of, or there's a border, and on that border of the magnet, it says, call 988 if you're in crisis, and it says cause a pause. And on the inside the frame of the magnet, you place a picture of a loved one. And that is on these quick access safes to add another level or another layer of barriers to accessing that safe in a moment of suicidal ideation, to get someone to pause and slow down and maybe go, oh, no, I don't want to grab this right now. And so is it gold standard, perfect, lethal means safety planning? Not necessarily, but is it meeting the gun owners where they're at? Yes, it is. And we have some statistics to demonstrate that. We're respecting their value around that. And one way I also like to explain this is through the Maslow hierarchy of needs kind of lens. We have those basic levels of needs that we have to meet: food, water, shelter. That next level is safety, right? Psychological, physical safety, emotional safety. And for many gun owners, owning a gun meets their psychological safety needs. And I know that may sound a little counterintuitive to some of us, but that is the frame of reference of a gun owner. And so I encourage you to step into that frame of reference when you're having those conversations. Okay, so using words like restriction, using words like locking it up, these are things that are going to send signals to their brain that says, whoa, 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 you're telling me that I can't be safe in my environment because now I'm restricting myself to my gun. So again, where do we meet them in the middle? A quick access safe with a cause a pause magnet on it. And we're seeing some success with that I'll show you here in just a moment. In addition to that, a few other language things to think about. We've even done some internal review with our intake forms here at the Mental Health Center. We've done a little bit of coaching with some of our staff, like the co-responder. And one thing to keep in mind is when you ask a gun owner, do you have firearms? That's generally going to be a red flag to a gun owner, because they are very skeptical of why people are asking that for two reasons. One, again, the stigma piece, they don't want to be labeled as a violent person. And two, they are skeptical that people are going to try to take away their firearms. So how do we rephrase that? A very simple way to rephrase that is, if you own firearms, do you have a preferred way to store them? Or how do you prefer to store your firearms? It's not even asking, do you own firearms? And I would encourage you, if you do ask that question directly, do you own firearms? Understand it could raise a red flag for them, not always, but follow up with the why you're asking that question, and assure them we're not asking to take firearms away. We care about your safety, and that's what we want to talk about, is your safety, and that's a piece of that conversation. So just hold those things in your mind if you're working with this population, or if you're working with anybody who's in crisis and is a gun owner. Just keep a few of those little pieces in mind as you have those conversations. And so what I'd like to do next is just show you some of the data we're getting from this specific initiative. I'm so thankful that the co-responders and the law enforcement officers are so willing to take this approach to crisis planning with individuals in the community. And before I dive into these numbers real quick, there's one other piece I want to mention. One thing we coach the co-responders and crisis teams on is to offer that quick access safe for that one firearm to help them meet that psychological need, while also providing a balance of safety in the home, and then locking the rest up and separating the ammunition from the other firearms if there are multiple in the home with cable locks and things like that. So that is our specific approach in these scenarios. And what the co-responders are doing and the law enforcement officers are doing is they are voluntarily filling out a form afterwards, after they have a crisis call where they've tried to distribute a gun safe, one of these quick access safes with this approach. They're filling out information and sharing that with us and sharing it among their teams, so we can start doing an environmental assessment on what's going on in the homes, and are we seeing some patterns that we can address. And this is the data we've collected so far as to date. And we only started this a couple months ago. Mid-June is when we started having these trainings with the co-responders. So we haven't really gotten this program out in the community for very long. But on the form that they fill out after they hand out a gun safe, there's a few questions, and here's a few of them. One is, was a safe distributed during your crisis call? We've had 12 responses so far, and out of 12 responses, we've had 9 yeses. 9 gun safes were distributed. That's like a 75% success rate that we were able to have an individual responsibly secure their firearm. And what was the reason for the visit? Out of the 9 yeses, 6 of them were for suicidal ideation. Again, going back to what Patrick said, there's that window, that kind of 1 hour window of, the thought and the action. And so we know that there were 6 community members in the last 2 months that had suicidal ideation, that took a safe and stored their firearm responsibly. And we can feel better about walking away from that home knowing we put some time and distance between them and their firearm. A couple other reasons that co-responders or law enforcement officers were visiting homes were general safety concerns, either for having kids in the home, or maybe another family member that was having a mental health crisis and needing to have some type of responsible storage and security. And then domestic violence concern is another response that we've had. And then what's going on in the home, thinking long term, are there children? That's another piece of this, because we're hopeful that if we get the gun owner to find that balance of safety and security for themselves with a quick access safe, they're utilizing that long term. And we see that kind of long term health behavior change for them. Because if there are kids in the home, we want to make sure that in the long run, they're storing things more responsibly. And so we're asking that question too. Are there children in the home? There have been, and more often than not, we're seeing children in the homes where these crisis calls are happening. And then locations. That is something that's helping us to determine, do we have hotspots in our community? Do we need to go into that specific area of the community with different messaging or more messaging? Do we need to talk to gun shops in that area? Do we need to do more training with co-responders and law enforcement in that specific area? And so we're starting to see some patterns emerge that are informing our approaches as we move forward. And I want to leave a few minutes left for time towards the end of this. So I'm going to spend just a couple minutes on another program that we are piloting right now. And I don't have time to get into all the weeds of it, but very briefly, what we have done is developed relationships with the gun shops in order to enable them to be an access point for mental health. Like Patrick talked about earlier, everybody plays a role. There is a program. It was started by a veteran. His name was Caleb, down in Louisiana. One day, a veteran that was a friend of Caleb's was having suicidal ideation. He owned firearms, and he knew he needed to separate from them. And so he took his firearms to his friend Caleb, who was his buddy, a veteran who owned a gun shop, and said, "Man, can you store my firearms for me while I seek help?" Caleb did it, and Caleb decided this needs to be a thing. Let's start a program. With a lot of help from the VA, the TAP program or the Armory Project was started in Louisiana. They've got like 40 shops down there. Some of them are just marketing partners promoting the program. Some of them are shops that are actually taking firearms in and storing them for individuals. And so we are piloting that here in Johnson County. And I can't get into all the nuts and bolts of it at this time because we're short on time. But what I can say is we have developed relationships with the firearm retailers. Many are interested in offering this service, and we do have one offering this right now in DeSoto, up in Arms, Kansas, and they haven't taken any firearms in yet. We just lifted this off, officially in April. But residents are going to be able to have an opportunity if they're going through mental health distress to store their firearms with a gun retailer. And really, the whole thing behind that is somebody they feel comfortable with. Maybe it's a gun retailer they use. Maybe they don't want to store with law enforcement or any other type of agency. They have a place in the community, and for clinicians in the community as well, if they're potentially worried about somebody, there might be an option to refer them. Hey, there's a gun shop that offers storage. It's private. They don't track anything. You can go there, have a conversation with the firearm retailer, and store your guns. There is a contract. They do have to pass a background check to get their guns back out of storage, which is a big piece of it. But overall, this is an option to meet gun owners where they're at, make them feel more comfortable about separating from their firearms temporarily and voluntarily. And so that's just another on the ground approach that we're taking with this community. And we have a lot of work left to do with this particular program, but we're very excited to be piloting it right now. And with that, I'm going to stop sharing my screen. And I know we've got about 8 minutes left, and we just wanted to allow opportunity for anybody to drop questions in the chat or ask us any questions that you may have, or just share anything that's on your mind with us while we have 8 minutes left today.
Yeah, so starting to get some questions. Before we get to them, again, if you have questions, we have the chat button and the Q&A button at the bottom. Feel free to utilize those. For those who are needing a certificate of attendance for today, I dropped that link and password in the chat as well. So feel free to grab that while we're answering questions. The first question we have here is from Paris, who asks, is there a timeline to expand the work you all are doing to nearby counties like Wyandotte County? They add, thank you. I'm so glad that this initiative is taking place and off to a solid start.
I'll take that one. So since this project is grant funded, a lot of our work is being done in Johnson County. However, Wyandotte is so close to us, and we've actually had a store, Frontier Justice, express interest in the Armory project. And so we are hopeful that some stores just outside of Johnson County will participate, which will allow for some more options for storage.
Sorry. A lot of positive feedback in the chat, not seeing questions. Here we go. Candace asks, are there parallel programs on the Missouri side? And also thanks you for the presentation.
Patrick, I'll let you take that one.
No, not at this time. And part of that, I'm glad everybody's focused on expansion, and this has taken a lot of time just to get where we are with the partners that we have. And so, love the idea of potentially making some inroads into other areas. The safe distribution piece of this is really up and running, and Mallory and Jared with Johnson County are doing great with that. The gun shop piece of it, we have a lot of great relationships, and we're still, continuing to work on those relationships, and get even more training directly to the gun shops and their staff. And so that has taken a bit of our a focus of just continuing to get the shops that we're engaging with even more online with education and providing resources and being marketing partners for Up in Arms Kansas. um, but if there are folks that are in other areas like Wyandotte or the Missouri side that want to explore this, I'm happy to connect with anybody and start making some outreaches. But this is a timely effort. This We didn't just walk in and they were like, okay. No, it took a lot of like going in and building that trust, like we've been talking about. So it takes time, but um, I obviously this is something that we would want to see everywhere, whether it's the safe distribution or the gun shops being more involved, or the community trainings, bridging that gap between mental health and the gun community. Yeah, we'd love to just spread it everywhere. And so but it takes time, and it takes people also. So if there are others, especially within this council, that are interested in looking at getting involved or being a piece, certainly reach out to us. I mean, I'm the Kansas City VA, so I'm on the Missouri side, so I have access to all of Missouri. Um, but yeah, certainly that's kind of where we are with expansion.
Awesome. We had 3 more questions pop up. We've got 4 minutes. I'm hoping we can get to all 3 of these. So the first one is there corresponding training and education being provided to local law enforcement?
Not currently. However, we're definitely open to it. Some of our law enforcement officers have been present in the co-responder training, so we've been able to give a couple of trainings to them. I know that Patrick has participated in one of the CIT council meetings, and so we've definitely been talking about the initiative within CIT. So it's an option for sure.
And then our next question, someone asking if they where they could purchase or get some of the safe magnets.
Send me an email, mallory.geverts@joco.gov. And those safes are free, and I can provide you with as many as I can.
And I just dropped that link in the chat as well. So Mallory's email address is on the webpage for Secure and Protect Initiative. So feel free to grab that there. Let's see. One of the questions went away. So one more I see here in the chat. I often encounter clients who say they are unable to afford firearm safes. Do you all know of any resources they could tap into to obtain one? And this is generally Missouri residents.
So I'll say, Pat and Mallory, you can jump into. Our gun safe distribution program is primarily focused on Johnson County, just the way our funding has our funding focus is right now. And we have, I didn't mention this earlier, we have expanded our gun safe distribution program from co-responders to the firearm retailers themselves. So we're providing a few amount of safes to all the gun retailers that we can in Johnson County, and they're distributing those at their discretion, and they have been distributing those to people who are having mental health challenges that they see in their store, or just general firearm safety concerns with little ones in the homes and things like that. So here in Johnson County, there's a few shops that are distributing those, but their quantity is low. As you can imagine, funding for these things are not cheap. And on the Missouri side of things, I don't know of any shops that are doing that currently. And so I can't speak to that on the Missouri side, but just expanding long-term into the future, we know that funding is going to run out at some point for free gun safes and free things. And so we hope to maybe make some inroads with some of the gun safe manufacturers where we can maybe provide some discounted gun safes in our community. So that is an aim of ours for the community around here as well. Just wanted to share that.
And just to add to that too, if you're interested in just some different suggestions on different ways to store firearms, there are other options besides gun locks, like adding locks to a door in your basement or something like that. So if you're curious about just some additional options, feel free to reach out to us and we can provide you a list of different storage options that might be more affordable than a safe.
All right. Well, that is our time for today. I just again dropped the link to the Secure and Protect Initiative page, which has Mallory's email address. There was a question in the chat about Mallory's email address. It is there on the Secure and Protect Initiative page. If you Google search Secure and Protect Initiative, Johnson County, it's going to be your first result as well if you aren't able to grab that link. I've dropped the certificate of attendance link several times in the chat, as well as the password, which is Mallory's last name, Gevertz 5.21. So we'll make sure everyone gets their certificates of attendance. As we wrap up, a reminder that today's presentation was recorded. You will be able to access it at mentalhealthkc.com. And then I've also posted the link and password in the chat for you to get your certificate of attendance. Our next webinar is the second Thursday of June, June 12th, from 12 to 1 p.m. Keep an eye on Metro Council's newsletter and social channels for information on that, and we hope to see you there. And just again, want to thank Mallory, Jared, and Patrick for the great work that they're doing in the community, but also for being here today and leading this presentation. So, and then want to thank all of you who attended today. I think we peaked at close to 100 attendees. So really good turnout and really good presentation. So thank you all so much for coming today, and we will see you next month.